Hey, what's up, everybody? Welcome back to another episode of Health Made Easy. I'm your host, Dr. Jason Jones, and this week we are going to be talking about something that I know everybody in here has heard of, but you may only relate it to one thing, and that is Candida and yeast overgrowth in the gut. Now, a lot of us have heard of yeast infections, those kinds of things, and we tend to think that's okay, well, that's just a female problem that happens in a certain part of their body. However, Candida overgrowth or yeast overgrowth is one of the hidden stressors that you do need to know about. So, Candida is just one fungus known to live naturally on the human body. So it's normally there, found on the skin, inside the gut, inside the mouth, of course, inside the vagina. And in small amounts, Candida yeast is not harmful and really doesn't cause any problems. It kind of lives instead of like a parasite, it's more of like a symbiotic relationship, which means it just sort of lives in harmony with your body. However, when you have an overgrowth anywhere, especially in the gut, caused by certain factors, the Candida infection can create a lot of problems. So what does cause a Candida overgrowth in the gut? Candida is a fungus. It is harmful basically harmless under normal conditions. However, when you get too much of it, your immune system is disrupted and the healthy bacteria levels start to fall. Candida may begin to overgrow in the gut and you become susceptible to it in other areas of the body. Now, some factors that can cause Candida overgrowth in the gut: diabetes, a weak immune system, high consumption of alcohol, high levels of refined carbohydrates and sugars in the diet, oral contraceptives, stress, taking too many antibiotics, being overweight, sometimes warm and humid weather, heavy smoking, pregnancy, not pregnancy in and of itself, but sort of the things that come along with the pregnancy, and also chemotherapy. So now, most of these are things that are under direct control of the individual. So make sure you pay attention to that. But symptoms of overgrowth in the gut is, it could be anywhere from the mouth all the way to the backside, okay? So the first one is oral thrush. And we sort of think about that with like babies when they have that white tongue. And that certainly is one, but that's more where it gets into the mouth and the throat. And it can cause soreness on your tongue and mouth. The soreness may spread to the esophagus. It may cause difficulty swallowing. You might have white patches on your inner cheek, on your tongue, on your gums, on your tonsils. The throat may also be associated as well. In addition to that, digestive problems is another one. An overgrowth of Candida in your intestines, or yeast or fungus in your intestines, does affect the level of good bacteria in your gut. So anytime it's off, because it's always there, the yeast is always there, the fungus is always there, but when it gets to where it's too many of them, and then your other bacteria and your other levels of like fungus and things like that start to drop, then you can result in having symptoms like diarrhea, constipation, loss of appetite, cramps, nausea, and bloating. Another thing that it could do is cause fatigue, because fatigue is one of the most common symptoms of Candida overgrowth in the gut. The overgrowth of Candida makes you less active. Your body feels weak, and you've not done any real rigorous work. So joint pain is another one. Candida overgrowth in the gut may cause the fungus to travel to the joints through the bloodstream, causing severe pain, swelling, and stiffness in the joints. And in some cases, this may result in the inflammation of the joint and a condition known as Candida arthritis. Also, to help prevent Candida overgrowth in the gut, you may lower your risk factors by eating a healthier diet, abstaining from smoking and alcohol, maintaining your blood sugar levels, having good personal hygiene, and being very careful about using antibiotics, or maybe just not using them at all unless it's an absolute emergency from there. So to conclude all of this, essentially what I want to tell you is, you need to know the factors that will create a weakened immune system for you. obesity, diabetes, and all those other kinds of things that may induce a Candida overgrowth in the gut and end up causing more and more digestive problems, but a whole bunch of other problems as well. So digestive problems are usually associated with, either constipation, diarrhea, oral thrush. Those are all symptoms of Candida overgrowth, but you could have it for a very long time in there and not have any real outward symptoms until it becomes too late. So just be on the lookout for that, and just know that it's not always you just ate the wrong thing when you have these chronic digestive upsets. It could be something like Candida or a yeast overgrowth. So hope this helped you. It's Dr. Jason Jones signing out. We'll see you on the very next one. See you later. Bye-bye.